Good morning. I hope you're having a happy day. This is Terry K. How is everybody doing this morning? I hope everybody is fine. Well, I'm here today to talk about the disease effect of diabetes. Now, I'm pre-diabetic. I'm not claiming it, but I was told by the doctors that I was pre-diabetic. Now, I'm not trying to say that I have diabetes or not, but it could eventually become diabetes if I don't take the proper measures to get my A1Cs right and to get my blood pressure, my blood sugars within stable ranges so that they won't be elevated. And I also want to take proper measures in taking, like diabetic medicine or just losing weight or the like to try to do something to combat this disease. I'm not trying to get this disease. I don't want this disease, but I have to do what it takes so that I won't get that disease. So let's get into it. Type 2 diabetes happens when the body cannot use insulin correctly and sugar builds up in the blood. Once it's builds up, it's called adult onset diabetes in adults. Over time, high blood pressure levels in type 2 diabetes can damage the eyes, the kidneys, the nerves, and the heart. This happens. Why? Because the pancreas doesn't make enough hormone called insulin to help sugar enter the cells. It happens also because the cells respond poorly to insulin by taking in less sugar. That happens. Now you have two forms of diabetes, two common forms of diabetes. You got type 1 and you got type 2, which can both be developed between childhood and adulthood. Type 2 is more common in adults. But there are an increase of number of obesity that is led among young people with type 2 diabetes. It used to be a time when people would say the juveniles were more prone to get type 1 diabetes and the adults would get type 2 diabetes. But that's not the case. You can have either kind as an adult or as a juvenile. There's no cure for type 2 diabetes. Losing weight, eating well, exercising can help manage the condition, but there's no cure. If diet and exercise aren't enough to manage blood sugar, diabetes medicine or insulin therapy may help. As for me, I'm not on insulin therapy. I take metformin, 500 milligrams, twice a day. Well, I can't say that. I'm scheduled to take metformin 500 milligrams twice a day. As a human and as a nurse, I don't always do what the doctor tells me. So I have to do better by myself to do what's required in order to keep my blood sugars down. Right now, I take a weight loss slash diabetic controlling injection called Wegovy. It's to help me lose weight, but at the same time it helps maintain my blood sugars as well. So I'm taking that. I'm losing weight, but it's not at the threshold that I'm hoping to receive at. So I'm also working on that as well. Now, we talked about diabetes and we talked about the overview. Now let's get into the symptoms. First of all, some of the symptoms you may not know you have them. More thirst, more urination, more hunger, weight loss. I haven't had weight loss. I have had weight gain. But because of some of the medicines that I take, it helps me to weight. It works the opposite of the weight loss. Tiredness. blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of darkened skin, most often in the armpits and in the neck. Those are signs and symptoms, some basic signs and symptoms. When to see a doctor. When to see a doctor? When you see all those symptoms, or at least most of those symptoms I just told you about. Okay, causes of type 2 diabetes. It results in cells in muscle, fat, and liver that don't respond to the insulin as they should. As a result, the cells don't take in enough sugar. If that happens, the gland that makes the insulin, which is called the pancreas, can't make enough to keep blood sugar levels within a healthy range. And that's when your blood sugars get out of whack. How does insulin work? Insulin is a hormone that comes from a gland that sits behind and below the stomach. The gland is called the pancreas. So it works in that area. And the insulin manages the body uses and sugar in some ways, such as sugar in the bloodstream causes the pancreas to release insulin. And insulin in the bloodstream gets sugar into the cells. That's what you don't want to happen. The amount of sugar in the bloodstream drops, and the pancreas releases less insulin. Okay? So, the role of glucose. Glucose is a sugar that is the main source of energy for the cells that make up muscles and other tissues. So glucose comes from two sources, food and the liver. Glucose goes into the bloodstream, then enters the cells, which help with insulin. Okay, the liver stores glucose in the form of glycogen and also makes glucose. When the glucose levels are low, the liver breaks down stored glycogen into glucose. This keeps the body glucose level within a healthy range. In type 2 diabetes, however, the process don't work well. Instead of moving into the cells, sugar builds up in the blood. So as the blood sugar levels rise, the pancreas releases more insulin. And over time, the cells in the pancreas that makes insulin are damaged. Then the cells can't make enough insulin to meet the demands of the body. So these are some of the telltale signs and symptoms of how diabetes gets started within our human body. With that being said, we're going to have to go into video 2 about the risk factors and other aspects of diabetes. So if you follow along with me to the next video, then we'll get it started there. Thanks. And thank you for being with Miss Nurse Terry K. And have a great day with Terry K.